Welcome to Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Patrice Walker, board certified OBGYN and also the Chief Medical Officer at the Medical Center Navicent Health. And today we're going to talk about pregnancy and COVID-19. Dr. Walker, thanks so much for being with me today.
Thank you for having me.
As a practicing OBGYN, can you tell us some of the things that women who are currently pregnant need to be doing in the COVID-19 environment?
Yes, I know it's stressful to be pregnant, period, but in the midst of a pandemic, I'm sure that there are lots of women that have questions about what they should do. One of the main things that I need to stress is what we're telling the general public, and that is, hand hygiene, washing your hands with soap and water for 20 seconds, wearing a mask when you're out in public, and don't go out unless you really, have to. Also, I want to stress that it's important for pregnant women to continue their prenatal care in whatever form that means for them. If you're high risk, that may mean going in to see your physician. If you're low risk, that may mean a remote visit. But either way, you need to make sure that you continue to get the prenatal care because the goal is still the same. That hasn't changed, to have a healthy baby and a healthy mom.
If a woman is thinking about getting pregnant today during the COVID-19 pandemic, is there anything that you would tell her to do differently?
Not really. You still want to, maximize overall health and eat a healthy diet and take the prenatal vitamins. So that part hasn't really changed. I don't think there's anything particularly different that we're telling patients who are thinking about getting pregnant.
So the same things we are telling all patients would apply to them around hand washing, social distancing, and wearing masks?
Yes, correct.
When families are thinking about coming to Navicent Health for deliveries, what are some of the things that we're doing in the hospital to keep the mother and her birth partner or coach safe?
Well, first and foremost, even before they get here, we have a standard that we are really trying to get all pregnant women tested before they come to the hospital. And in many cases, we're able to do that for patients that are having a scheduled induction or a scheduled C-section. And so we have a particular date that we are aware of. But even for patients that aren't able to do that, once they come, we are doing universal masking of all of our healthcare workers. Any visitor of the patient is also masking. We're doing, temperature checks. And so we're just trying to make sure that if people are exposed or are potentially carriers, that we have that mask as a barrier, that we're screening people appropriately. We have put in place various cleaning protocols to make sure that all of the surfaces in the patient care areas are cleaned. And we're really just trying to make sure that we, maintain all of the various guidelines that the CDC has put out.
Some of the feedback that we have gotten from families as they prepare to come in for delivery is around essential visitation. Can you tell our audience why essential visitation is so important?
Yeah, so it's very difficult. Generally speaking, you have a baby and you have lots of visitors and it's really a happy time, but we have really had to restrict visitation for the safety of the mother, the baby, and all the rest of our staff and workers. So we are allowing that one essential visitor, and that can be whomever the mother decides, a support person or spouse or significant other, whomever, but really just that one. And we want to minimize the in and out of that person. So if they're there to support the mother, they need to be prepared to stay the length of her labor course, whatever that may be. Because once they're there, if they leave and come out, then we don't know what exposure has occurred.
After the delivery, when parents and the family are taking the baby home, is there anything that they should be doing differently during the COVID-19 pandemic?
I think that is a good thing to sort of go back to for those that may not, choose to do that. And it goes back to the same thing that I talked about for the pregnant mother. It's just minimizing the risk, because that baby has the same risk of contracting the virus as the mother does. And so any time that you bring the baby out, then everyone loves a cute baby. So they're gonna wanna come up to the baby and see the baby and touch the baby. And so every time they do that, that's a risk of exposure. So the more that you can sort of wait, the better. I would also recommend potentially breastfeeding. We know that breast milk is healthy. It carries lots of antibodies and things that protect the baby, especially in those first months before the vaccine series starts. And so we always want to encourage breastfeeding in our moms to help the immune system of the baby. So that's another important thing. Of course, babies and any children under the age of 2 can't wear face masks or face shields. So you don't have that option. The only options you really have is distancing and, hand washing, quote unquote. But so honestly, the distancing is really going to be the best factor for a newborn.
Have we seen any evidence around passing COVID-19 from the mother to the baby?
Limited evidence, and it's all really limited at this point, shows that we don't think it can be passed on through prenatally, I guess. There have been limited cases of babies having positive tests after delivery. However, they can't confirm when the transmission happened. They don't know if it happened at the time of delivery, immediately after delivery, or sometime in between. But we really think the risk is low. However, what we are more concerned about is the transmission from the mother or another caregiver to the baby once at home. So I mentioned breastfeeding before. You do want to make sure that you clean the breast before breastfeeding if you've had an exposure or, of course, are symptomatic or otherwise believe you may have COVID or have been diagnosed with COVID. Having the disease itself is not a contraindication to breastfeeding. However, when you're breastfeeding, of course, the baby is held close to you, you're looking down at the baby, so you want to minimize the potential exposure. So a mom should wear a face mask, again, wash the breast, but the act of breastfeeding itself, we think that the benefits in most cases are going to outweigh the risk. A mom could also choose to pump breast milk, and that, you would go through the same things. That would allow another caregiver to potentially feed the baby. And in most cases, if the mom is truly COVID positive, we would recommend pumping and having someone else feed the baby. But if that's, if there's no desire for that, then at a minimum we would say put on the face mask and, hand hygiene and wash the breast.
Thank you so much for joining me today, and thank you for joining us. If you'd like to know more about our COVID-safe protocols here at Medical Center Navicent Health, please visit us at navicenthealth.org.